everyone, today we're going to talk about lower eyelid surgery. Are your lower eyelids saggy or puffy? Do you appear fatigued or swollen all the time? Or do you have sagging or wrinkled skin behind your eyes? Lower eyelid bagginess can produce a lot of tension, which can have a huge influence on your life. Lower eyelid sagging can have an impact on how you feel, both physically and psychologically, as well as how others perceive you. Fortunately, there's a relatively easy outpatient surgery that may remove lower eyelid bags and enhance the texture of your eyelid skin, giving you a smoother, more youthful appearance that will improve your comfort and quality of life. The term lower eyelid surgery includes a collection of surgical techniques that aim to improve the appearance of the lower eyelids. Our role today is to answer most of our questions regarding lower eyelid surgery. Today we have Dr. Kim, who is a leading doctor at BK Plastic Surgery. He is going to discuss with us everything about lower eyelid surgery from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so next time you'll be updated with our new releases. So moving on to lower eyelid. So what is a lower eyelid eye surgery?
Lower eyelid surgery is commonly performed when the skin starts sagging. Commonly in older people with wrinkles with bulgy fat in the orbital area. However, it can also be performed on younger patients when the eyelid is inverted and the eyelashes grow inward.
So in what cases would the client decide to have a lower eyelid surgery?
Commonly, lower eyelid fat starts to bulge and protrude as we age. As the fat bulges, a depression forms directly underneath, and as the light casts a shadow on this depression, we start to have these eye bags. In such cases, when we pull on the lower eyelid and perform a fat reposition to flatten the fat, we can take care of the bulge and the wrinkle at the same time.
So how long would the bruise and swell normally be still after the surgery?
Eye surgery, whether it be upper, lower, eyelid, or epicanthaloplasty, inherently entails a risk of developing swelling and bruising. Most cases, they disappear within 1 to 2 weeks. It may last a few more weeks depending on each person, but it happens rarely.
Do we have to come back for stitch removal?
After incisional double eyelid surgery, or epicanthaloplasty, you have to visit 5 to 7 days later for stitch removal. Non-incisional surgery does not require stitch removal.
So are there any side effects for lower eyelid surgery?
The most severe side effects in lower eyelid surgery is ectropion, which is when the eyelid turns outward to reveal the vascular surface. This occurs frequently in eyelids that have lost their elasticity due to old age, and since there is a surgical prophylaxis for this side effect, it is important to take such measures to prevent this from happening.
So for our last question, since lower eyelid surgery is readjusting the fat inside our lower eyelid, so would the fat regrow after surgery?
The most important component of lower eyelid surgery is fat repositioning. It's flattening the bulging fat. Essentially, when in the past they were simply removed. These days, we use the bulged fat to fill in the depression on the lower eyelid. In other words, reposition. Therefore, you don't have to worry about regrowing, and the repositioning fat takes care of the bulging fat at the same time. So it is a surgery that can produce good results without causing much to worry.
So thank you so much, Dr. Kim, for joining us today. 시간 내주셔서 감사합니다.
Thank you.
Today, the doctor explained in details everything related to lower eyelid surgery, which is designed to target and resolve underlying anatomical issues responsible for signs of aging in and around the lower eyelid. Thank you for joining us once again today at Cloud Hospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as we can.